Good afternoon.
Good
My name is
afternoon.
Tashia Fisher.
Bill Pearson.
Nice to meet you.
Have a seat.
Thank you.
How you doing, Ms. Fisher?
I'm doing fine.
Glad you took my offer on the interview today. I'll ask you a series of questions. Let's go ahead and get started. Why did you select a career in nursing?
I selected a career in nursing because nursing is something that I've always been compassionate about. I've enjoyed being able to nurse people back to a healthy state, and I enjoy also providing people with tools necessary to live a well life.
Where do you see yourself 10 years from now?
10 years from now, I see myself enrolling in a doctorate degree program at Virginia Commonwealth University in hopes of obtaining my doctorate in nursing practice.
How does this position meet your short and long-term goals?
This position will meet my short-term and long-term goals by allowing me to fine-tune the skills and the evidence-based practice care that I learned in nursing school, as well as fostering growth and development for future goals that I may create.
How has your educational and work experience prepared you for this position?
My educational experience has provided me with 560 hours of direct patient care, as well as knowledge about evidence-based practice care. By implementing those two things and being in the clinical agency, I'm able to function in time-sensitive situations and events because we have experienced 7 different clinical rotation sites. My past work history, I was a pharmacy technician where I was performing administrative as well as counting, retrieving, and fixing insurance issues. So I'm well aware of working within time constrictions and providing patient care, direct patient care, and displaying advocacy and problem solving.
Can you describe to me an encounter with an angry or frustrated patient or family member, and how would you handle it?
Yes, I had a patient that was very apprehensive about leaving. She translated those feelings over to her husband, which in return became very frustrated. To calm the patients down and to do my job properly, I went in, gave them realistic time frames of when she was going to be released, and together we worked to get her released as early as possible. While I was taking her to the vehicle, she expressed to me how happy she was with how quickly we got her released, and we were able to accomplish that by being realistic as well as working together with the patient and the family member.
Okay. Can you give me an example of how you handle rapid or unexpected change?
Yes. I was assigned to 2 patients one day while on a clinical rotation, one of which got released shortly after I received her into care. Another nurse had a heavy workload, so I took one of her patients, which had 15 scheduled PO medications on top of the workload that I had for the patient in my care originally. To get these changes done, I went in, let the patient know everything that was going on. I also let the patient that was originally in my care know what was going on so that I could have time for both of them and also get everything that I needed to get accomplished in a set time frame and also do it thoroughly.
Can you tell me about a time you had to build motivation or team spirit with members of a work group?
Yes. As previously stated, I used to work in a pharmacy. We had a goal of 830 flu vaccinations. To reach that goal, I displayed enthusiasm, which then translated over to my other employees as well as our pharmacists. And we were able to not only reach the 830 flu vaccine goal, but also exceed that goal by 10%.
Okay. Next, I will ask you a couple scenarios.
Okay.
First scenario, you are working on an evening shift of a surgical unit. Mr. Jones returned from the post-anesthesia care unit following a hip replacement 2 hours ago. While in the recovery room, he received 10 milligrams of morphine sulfate intravenously for incisional pain. 30 minutes ago, he complained of mild incisional pain, but then drifted off to sleep. He is now awake and complaining of moderate to severe incisional pain. His orders include the following pain relief order: morphine sulfate, 8 to 10 milligrams, IV push every 3 hours. For pain, it has been 2.5 hours since Mr. Jones' last pain medication. What would you do?
I would assess Mr. Jones's pain by asking him to rate it on a scale of 1 to 10. I would also offer to provide other pain relief remedies prior to giving him the morphine. If none of the other medications or pain relief remedies were effective in relieving his pain, I would administer the morphine as prescribed and rate his pain 30 minutes after administering the morphine IV push.
Next scenario. One of your LPNs on your team seems especially tired today. She later tells you that her new baby kept her up all night. When you asked her about the new 26 blood level on Mrs. White, who is 82 years old, she looks at you blankly and then says quickly that it was 150. Later, when you are in Mrs. White's room, she tells you that she does not remember anyone checking her blood glucose at noon. What do you do?
I would obtain Mrs. Jones's blood glucose, make the revisions into the system. I would go to the LPN, let her know that that was an unsafe practice, and also ask her again if she did indeed do a finger glucose and Ms. Jones just doesn't remember. After doing those, if the LPN did not do Mrs. Jones' blood glucose, I would let my immediate supervisor know.
Last question. Why are you interested in our organization?
I'm interested in your organization because of the core values, those being deeply rooted into the community. I look forward to providing care to those people in the community, as well as providing education to prevent possible disease processes in our community, as well as providing the patient-focused care when the patients come in and they're not well.
Do you have any questions for me?
Yes, I do. What type of educational development opportunities do you offer at this facility?
Well, at this facility, we have numerous education opportunities for our employees.
Okay.
A number one opportunity is the tuition assistance program that we have here for all employees that want to go back to school and better their education. That's mainly sought out maybe a year or two after their employment.
Yes. I would also like to know if there are immediate advancement opportunities. For example, how long would an employee have to be here in order to be advanced to a position that would allow them to use skills learned to better help the facility?
Well, advanced opportunities, like I said, mainly a year. But if you can show me that you are well-rounded and fitted for the job, I have no problem putting you in a higher level position in my facility.
Okay. Thank you. I appreciate this opportunity. Thank you for considering me as a future employee of this company.
Thank you. Have a nice day.
You too.